So, good morning, everyone. This is Dana Parsons, and thank you so much for joining us today for our weekly member call. Let's get started here. I wanted to talk a little bit about, before we get started with the Department of Health update, we have some advocacy that we would like for you to participate in. The House and Senate are currently working on the next COVID-19 relief package, and the Senate is going to be meeting very soon. So we have the opportunity to get some key pieces of legislation in that are needed for provider relief. So we really need for you to reach out to your legislators, and if you could please send a message, I will put that email in the chat box in just a moment, and it's also in our updates as well. Next slide. I also would ask if you could please save the date for April 21st for the LeadingAge Virginia Capitol Hill Virtual Lobby Day. LeadingAge recently announced its 2021 priorities, and you'll be hearing about them as the congressional agenda unfolds, but we're asking that you please save April 21st. That's usually the date that we go to the LeadingAge Leadership Summit and go to Capitol Hill and meet with lawmakers at that time to talk about issues that are priority to us. But because of COVID, we won't be able to do that, but we will be able to move forward with that virtually. So we'll be getting more information to you about that. So please save the date. Okay, so we're going to start off with a Department of Health update from Michael Magner. Thank you so much for joining us. Over to you, Mike.
Hey, good morning, everyone. Can you hear me okay?
Yes, we can.
Okay, great. Hey, I can't see my slide, but I know what's on it. So what you're seeing right now is the long-term care facility data. With regards to the CVS and Walgreens federal pharmacy partnership. As you can see, all of the skilled nursing facilities have finished with their first and second dose events. And they're starting to work their way through the third clinics to clean up anybody who still needs a second dose. And they are administering first doses as requested by the facilities during those visits. If there's anybody that's come in that still needs a first dose, they are doing that. Assisted living facilities, they're almost done with all of the first dose events. I think CVS had a few of their long-term care facilities that deferred vaccinations for the first visit due to outbreaks and other things. But for the most part, all of them are probably in second dose events right at this time, and we'll be going into the third clinics here very soon. So this will finish up within the next few weeks. So the question has been all along, what's next after the CVS Walgreens partnership comes to an end? How are we going to meet the needs of long-term care facilities in the long term? And the long-term answer has always been that we will continue to provide vaccine to the pharmacies and providers that normally provide this service to long-term care facilities. So this would be your normal pharmacy partnership. However, there is a gap in coverage right now. So as we're kind of still in that point where vaccine supply is still pretty limited, we have set up this Redcap survey. So you see the link there, and you can click on that if you've got the version of the briefing that allows you to click on that. If you need to type it, please capitalize it the same way it's in there. That link is case sensitive. Once you click on that link and submit a request form, and it's going to be a rolling request, so you can request up to 3 weeks out. It's going to ask you for very specific information regarding the number of people that need each vaccine, whether it's Pfizer or Moderna, for second doses and for first doses. And then we will actually partner you up with somebody. You can designate the partner that you want if you have a partner in mind that you want to work with. But there is an option to designate that partner. But if you don't have one, that's okay. We'll match you up. We actually started this process on Friday. As of yesterday morning, we'd already got 96 requests for assistance, and I think it's growing from there. So our team is working through these. There is a process that it takes. So first thing we have to do is evaluate the request, find out how many vaccine doses you need, which type, identify based on your geography who can serve as that partner pharmacy, coordinate with them directly to make sure that they're able to take on that caseload, and then work to get them vaccine, which may take anywhere from a few days if we can redistribute vaccine locally, or a couple of weeks if we have to put the order in for like a following week. So I just want to make sure expectations are kind of tempered a little bit in the fact that, based on if you put in a request today and say we need it by Friday, we probably will not meet the by Friday timeline. We'll do everything we can to get it as soon as possible. We know that these doses are timed, and optimally people would get their second dose at 21 days. There is a little bit of leeway per the CDC guidance to go a few more days after that. And then, if they don't get it within that time frame, they're still, once they do get their second dose, regardless of how long that time interval, there's no requirement to restart the series. So we are trying to meet those timelines, but I do want to temper expectations. Vaccine's still limited, and there's still a lot of parts that have to be done to coordinate that. But that's pretty much all I have in my presentation today. At this point, I can take any questions you may have.
Thanks, Mike. I did put a link to the Redcap survey in the chat box if anyone needs it. Melissa, do we have any questions?
Yeah, one came through, Mike. Is it correct that CVS and Walgreens are moving to Moderna for vaccines moving forward?
So CVS is, as part of the retail pharmacy partnership, is getting Moderna vaccine, but that's not specifically to this program, but that's more for the retail side. I think going forward, I'm not sure about Walgreens if they're going to be, I think they're getting some Pfizer vaccines as part of that federal retail pharmacy partnership. But our plan going forward with the long-term care facilities, when we show up, we'll do second doses of Pfizer to finish out the series. But I think what we want to do is start first doses with the Moderna, because I think we've got more places that we can get Moderna to, due to the fact that we only have to order 100 doses to meet a local order for Moderna, and the Pfizer's still like 1,100 doses. So that's something that when they come out, if they do first or second doses for Pfizer, they might also bring Moderna out and do first doses with Moderna. But that's all, depending on what the needs are locally.
Great, thanks. Dana, that's the only question we have. Thanks.
Okay, thanks, Mike. I really appreciate your update. Thanks for being on. If we have any additional questions, we'll reach out.
Okay, so great. Thanks, because I really got to run. I'm trying to put out another fire.
I understand.
Unrelated to long-term care. So
yeah,
okay.
Thanks so much.
All right, thank you.
Thank you. Okay, well, we're going to move on to our next discussion about quarantine of exposed individuals that have been fully vaccinated. So thank you, Dr. Abdel-Fattah. I apologize if I did not pronounce that correctly, but thank you for being on. You are the clinical investigations consultant with the Department of Health, and thanks so much. Over to you.
Hi, good morning. Can you hear me okay?
Yes, we can.
That's great. I've been having a trouble with my internet connection this morning, and I couldn't join through the meeting link, so I'm joining by my phone. So I hope everyone can hear me clearly.
We can, and we have your slides here, so you can just let us know when you want us to move on to the next one. So we're ready to go.
Okay, great, because I can't see them, so that would be great. Good morning, everyone, and thank you for having me today. I'm going to go over some key updates, some key CDC updates in regards to infection prevention and control, recommendations in healthcare settings, specifically to long-term care facilities. So the first one will be related to the quarantine of exposed individuals who are fully vaccinated. I will start with the just to give you a background of the current recommendation. We have so vaccinated persons with exposure, with an exposure to someone infected or colonized. I'm sorry, someone. I'm working on multi-drug resistant organism problem, so I'm so sorry for that. Just zoned out. So anyone who, in general public, who's fully vaccinated and might be exposed to a confirmed or a suspected COVID case, currently they don't have to quarantine if they had their full vaccination. Like it's been 14 days since their last, or 2 weeks since their last dose or the second dose, if it's 2 dose vaccine, or more than 14 days following 1 dose of a single dose vaccine, which we don't have currently. Hopefully, we will have that soon. The second condition, so 3 conditions. First one, having 14 days passed since their second dose of the vaccine. The second condition is it's within 3 months following the last dose of the vaccine. And this individual has to remain asymptomatic. If they develop any symptoms, they should isolate or quarantine as their recommendation. So in general public, any individual who has been fully vaccinated and they meet these 3 criteria, currently based on the recommendation, they don't have to be quarantined. How much of that is applicable to healthcare settings or long-term care facilities? Next slide, please. So in healthcare settings, we have healthcare staff and we have patients or residents. So first, I will talk about healthcare personnel. And please remember that these recommendations are based on the information and the data we have so far. And there is multiple studies conducted by CDC. Actually, it's ongoing by CDC, by Johns Hopkins and other educational institutes looking more into the efficacy of the vaccines we have, and also looking into the effect of the vaccine on our immune response. So that being said, these recommendations are the most current recommendations. However, that might be changed as we learn more and get more data. For healthcare personnel, there is, as a part of staff shortage mitigation strategies, or if the facility has like contingency or crisis staff shortage, they can allow asymptomatic healthcare personnel to work if they receive the full vaccination, the 2 doses, they remain asymptomatic, and it's been 14 days since they received the last dose. So in addition to that, they need to monitor for their signs and symptoms, and also wear the full PPE and follow all the recommended infection prevention and control during that time. Fully vaccinated healthcare personnel wouldn't be required to quarantine outside of work. Also, as a contingency strategy option, there is a chance for a healthcare worker, if they didn't receive the full vaccination, like they received 1 dose or they didn't receive any, if they have a high risk exposure, and on my slide, there is, because we received some questions about what do we mean by high-risk exposure. So if you click on that link in my slide, you can find a lot of information. It will take you to the CDC webpage. There is a table over there explaining what type of PPE the healthcare personnel was wearing and during what procedure, the distance, and all of these factors that might explain what do we mean by high-risk exposure. I'm not going into details, but if a healthcare worker had a high-risk exposure and they didn't receive the full vaccination or they didn't receive the vaccination at all, they can still work as a strategy to mitigate staff shortages if they remain asymptomatic and or they can quarantine for a shorter period than the 10 days, like if they remain asymptomatic for 5 days, for example, they can use the test-based strategy. And if the testing came back negative, they can go back to work as early as 7 days. So there is different levels of or different strategies to mitigate healthcare personnel shortages in long-term care facilities. Next slide, please. So on this slide, I will talk about quarantining exposed patients or residents who are fully vaccinated in long-term care facilities if they get exposed to confirmed or a suspected COVID case. Unfortunately, based on the information we have so far, they need to be quarantined for 14 days or even longer if they have an immunocompromised condition. And the reason for that, that we don't have clear understanding of how the vaccine or about the vaccine effectiveness in this population. Definitely, they are very vulnerable. They have high risk of mortality and morbidity, COVID-related mortality and morbidity. And it's very difficult with providing care to keep the social distancing. So that's why if I have a resident in a long-term care facility who received the full vaccination and it's been 14 days, however, they get exposed to a confirmed or a suspected case, they still need to be quarantined as recommended till we get more clarification or more data about the effectiveness of the vaccine in this patient population. However, although it's not preferred, in some situations, healthcare facilities could consider waiving quarantining for vaccinated patients or residents as a strategy to mitigate critical issues, like, for example, staff, PPE shortage, or lack of space. Also, it's not, I will repeat that, it's not, excuse me, it's not preferred. However, in some situations, there can be an exception, and these residents, they don't have to be quarantined till they meet criteria to discontinue the transmission-based precaution if there is a shortage in staff, PPE, or lack of space. However, that decision, it's better to be made in consultation with your district or your local health department. I put the CDC link on my slide, so if you need more information or you need to read more about that, you can just click on the link and it will take you to the website. Next slide, please. So these two slides, I'm talking about actually a very recent update to CDC recommendation that has been released over the weekend. So I didn't even have a chance to present that to the task force. maybe in the next meeting, task force, long-term care task force meeting, we will talk about them. But I found it a good opportunity to share that with you as well. So on this slide, I'm talking about quarantine of exposed individuals in healthcare settings or long-term care facilities within 3 months of a positive test for SARS-CoV-2, which is the virus causing COVID. I will talk first about asymptomatic healthcare personnel who, if, for example, I have a staff who had a confirmed COVID infection, positive test within the past 3 months, and they had, during these 3 months, they had a high-risk exposure. Do I need to let them leave, or do they have to leave work and quarantine for the recommended, or till they meet criteria for return to work criteria, I mean. Based on this new recommendation, they don't have to. They can work while monitoring their symptoms, and definitely wearing the recommended PPE and all of that. However, some facilities in certain scenarios or in certain situations might reconsider keeping that healthcare worker work after their exposure, during their first 10 or 14 days. These situations that where we are not sure about the test result maybe, or the immune response of that individual. And let me try to explain that more. For example, if that particular healthcare worker during these 3 months, or even when they got the infection the first time, they had a problem with their immune system, any immunocompromised problem, or they developed the immunocompromising problem during this 3 months window, like being on a chemotherapy, for example. This will affect their immune response. And in this situation, the facility might reconsider quarantining these healthcare professionals based on their immune response, because they are not sure about, or we are not sure about, their previous immune response to the infection. So this is the first situation. The second situation is if we are not sure, if the facility are not sure about the previous test results. Like, for example, if that healthcare professional had an exposure previously in the past 3 months, and they didn't develop symptoms. However, they have been identified as positive by the point of care testing or the antigen testing. So they are asymptomatic, but they have a positive test, and they didn't confirm that positive test with the PCR. So this result is not highly sensitive. And in this situation, we are not sure about if they actually had the infection or not, because the result wasn't verified with a PCR, which has a better sensitivity. So in this case, facility might consider that the second infection or the second exposure will put the healthcare professional at risk, and they need to be excluded from work. The third situation is if a healthcare worker I'm sorry. They have been exposed to a person, their high-risk exposure the second time was exposure to a person known to be infected with one of the new variants, which we don't know a lot about them. So in this scenario, also the facility might reconsider this healthcare worker to be excluded from their work duties till they meet criteria to return to work. I hope I'm not confusing anyone, but I'm willing to answer any questions you might have after my last slide, which is the next slide. So next slide, please. So the same concept is also applied to residents, any resident at a long-term care facility who has been, who had previous confirmed COVID infection within the past 3 months. If this person gets exposed to confirmed or a suspected case, COVID case, they also don't need to be quarantined, or you don't need to put them on transmission-based precaution as long as they remain asymptomatic. However, the same 3 exceptions might be considered. If this person has a problem with their immune system during the second exposure, so either that has been there since their first positive or developed during these 3 months, this can be a consideration. The other scenario is also exposure to someone who has the infection with a new variant. And the third situation, same, if we are not sure about the previous test result, if the resident was asymptomatic during that time and they have a positive antigen testing and that wasn't confirmed with a PCR, so in this situation, we might not be sure about the test result. So these all are the updates from CDC that I would like to share with you all, and I'm happy to take any question. Thank you.
Thank you so much, Doctor. That was really a lot of really great information. We do have some questions, I believe, Melissa.
Yeah, the questions are about independent living. So what recommendations are made concerning independent living apartment residents resuming visitation within their private apartments? Sorry, the dog is squeaking in the background. Specific guidelines would be in place to ensure guests are escorted in and out of the building and there would be no exposure to other residents. Infection control measures are taken and masks are worn.
Okay, so in regards to visitation in general, we don't have any updates. However, we are on the several calls with the CDC and multi-state calls. It seems that CDC and CMS are currently working on a new document to relax some of these guidelines, but till we have that recommendations, we don't have any change to our previous visitation restrictions or group activities. Everything will remain the same until we get that new document. We are hearing about that. We've been hearing about that in the past few weeks. So anytime soon, because we don't want to start relaxing these recommendations and we don't have clear understanding of the effect of that vaccine on our immunity. So just hold on. It's not going to be long. And but so far, all recommendations are the same as previous till we get new updates.
So Ryan and Peggy, I hope that addresses your questions in the chat. I will say that I've been speaking to members who on the independent living side are starting, because that's not regulated, they're starting to open up beginning next month. So they're starting to look at allowing family members to visit their residents who are in independent living in their apartments. So perhaps Dana, on a future member call, we could showcase some of those members who can talk about their plans. There's a couple other questions that have come in. I have families really pushing to be able to feed their residents. Anything on feeding?
Okay, I can say that at this time, we're not aware of any guidance related to that. I do know that LeadingAge and Pathway Health have created a number of tools and policies related to a lot of nursing home activities. I will put that link in the chat box for everyone. I just put a link in for some general resources, but for this toolkit, I will put that in right now. And I think you might be able to check that out to provide some resources that could potentially address that question. And I see that Karen Riley, we quarantine new admissions from the hospital. Oh, she's answering. I'm sorry, Melissa, I'm taking over your job.
No, you're fine because there's a lot of squeaking going on over here. I mean, so Karen says we quarantine new admissions from hospital. So a resident who's within 3 months of a positive test, we should not have to isolate. What about new admissions fully vaccinated? So do we have to isolate a new admission who is within 3 months of a positive test?
So in long-term care settings or yes, in long-term care settings, if you are receiving a new admission from a community or from a hospital and they receive the full vaccination, they still need to be quarantined for 14 days based on the recommendations we have so far. That might change, but so far, yes, you need to quarantine them for 14 days, monitor their signs and symptoms, wear the full PPE as recommended until we get an update to these recommendations.
So it sounds like more questions than answers right now, but more answers should be forthcoming.
Exactly.
Okay, that's it from the chat, Dana.
Yeah, and Ryan, I will follow up with you and see if I can get any additional information to you on the feeding issue. So thank you so much, Doctor. Really appreciate the information that you've provided. As soon as CMS provides some additional guidance that's loosening some of these requirements, we will definitely have that as a topic on a future call. So as of right now, we do not have a call scheduled for March 3rd. However, if any guidance or any information comes in regarding some of the questions that have come up today, that will certainly be our focus for that call, and we will keep you informed about that. In the meantime, if you have any questions about anything that we've addressed today or any other questions, please feel free to reach out to me. I did want to put in a reminder, the last slide, please, to definitely save the date for April 21st so that we can do some virtual lobbying from your communities. This is such a great opportunity for you all to be able to reach out to Congress without having to leave your community. So if there are not any other questions coming in, I think that unless there is any other issue that anyone wants to talk about before we end for the day, I know everyone's time is precious, so I want to be very mind-worthy of that. So I will leave it open just to see if there are any other questions. Okay, well, seeing none, please check your update for information about a potential call on March 3rd. We'll keep you updated about that. And again, please reach out if you have any questions. Thanks so much, everyone, for being on. And thank you again, Doctor. Appreciate the information.
Thank you so much.